this is Vaishnavi of medical student. Can I know your name, please?
My name is Ramesh.
Of age?
40.
Okay. Today I would like to perform an musculoskeletal examination. Is that okay with you?
Okay.
Uh, so I'm. So you have to take your shirt off. Is that okay with you?
Okay.
Inspect shoulder girdle anteriorly and inspect scapula and muscles carefully. Note if any kind of swelling or any kind of muscle atrophy. Palpate for the tenderness at sternoclavicular joint by the clavicle laterally with the fingers and posteriorly find the bony spine of scapula laterally until it becomes acromion. From these and palpate acro acromioclavicular joint from there to coracoid process of scapula. Palpate the greater tubercle and biceps tendon in the intertubular. Check for the tenderness. And now lift the humerus posteriorly so you can palpate over the subacromial bursa and subdeltoid bursa, and also palpate the sits muscle which includes supraspinatus, infraspinatus, teres major and subscapularis. Take the patient's arm to the 90-degree of flexion and then get the arm at maximum horizontal adduction. Consider it a positive test that produce pain on the top of the shoulder at acromioclavicular joint. For this test, tell the patient to bring back both hands together, one from the elbow and from other from the pillow. Repeat this switched arm. The dominant shows more restricted than the other. Stand behind the patient. Stabilize the scapula. Bring the arm into the maximal passive shoulder flexion. This test is considered positive if the patient experiences any kind of pain. Have the patient of his affected arm in the 90-degree of the shoulder of the flexion and the elbow flexed to the 90 degrees. Fixate the scapula with the one hand and hold the patient elbow with the other hand and add the passive internal rotation to the glenohumeral joint. Considered positive if patient gets pain. Bring the affected arm into the 90-degree of the abduction and external rotation passively and tell him to release slowly. If unable to move, slow down, then it is considered as positive. Arms of the patient are elevated to 90 degrees in scapular plane. Arms are fully internally rotated so the thumb pointed downwards. Then we should apply the downward pressure. Consider positive if pain affected. See the patient fingers or ask him to move his fingers naturally. Softly moving when fingers are relaxed, then they should be slightly flexed. And also notice the patient wrist and note if any swelling in the joints as well as any deformities in the palm thenar and hypothenar. And now palpate the distal radius and the ulnar of the lateral and medial surfaces of the wrist. And now palpate the radial styloid bone. Now palpate the 8 carpals and see for the fractures and bugginess of bony enlargement or tenderness. See for anatomical snuff box. Ask patient to hold your fingers and ask him to squeeze as hard as he can. Loss of strength may indicate arthritis. Ask patient to grab his thumb and palm and ask him to squeeze as hard as he can. Make note of any kind of pain towards the midline. This test is done for the carpal tunnel syndrome. Lift patient's thumb slightly away from him and observe the patient face for any kind of pain. Gently tap on medial nerve and ask him for any kind of pain on fingers. Ask patient to put back of his hands together and ask patient for any kind of pain in fingers 2, 3, 4. Keep patient in supine position and his knees into the flexion. Inspect the knees, noting their alignment and any kind of deformities, and note normal halos around the patella or entropy for quadricep muscles, and palpate suprapatellar pouch and note for any deformities, swelling. Sweep the middle restraint of knee joint upward such that any fluid is displaced from median side. And now sweep from the suprapatellar pouch laterally downward. Need to push fluid back into the medial side and see bulge scientist. Patient in a fully stretched legs, then to stroke downwards until you reach the suprapatellar pouch and press downward with the other hand and stop just below the apex of the patella while applying downward pressure. Take a finger and press on patella as see floating the fluid is accumulated under it. And fully stretched legs. Now rotate the tibia medially and bring knee to the extension and repeat couple of times. In test medial meniscus, bring the knee to the fully flexed and laterally rotate the tibia. Positive when he has pain. The ankle with one hand and other around the knee so the thinner air against the tubular height. Now push medially against the knee and now laterally against the ankle in attempt to open the knee joint and look for variation. Tell the patient in the relaxed position and apply lateral rotation in the knee joint and perform passive adduction. Place the patient of hip 45 degrees and knee 90 degrees and place weight on the ankle and palpate joint line with thumb. Move tibia anteriorly and an explosive movement. Positive if it moves anteriorly. Take the leg flexion of 30 degrees. Fixate the femur with other hand. Bring the tibia slightly external rotation. Consider it positive when you feel mushy like. To be relaxed. Hip 45 degrees, knee 90 degrees. Palpate the joint and push tibia posteriorly. Consider it positive when it moves posteriorly.